Peptides are powerful and often misunderstood.
And we're here to change that one conversation at a time.
I'm Dr. Kylie Burton.
And I'm Jessica Bricky.
This is Pep Talk. Peptides unpacked. Science made simple. Results made real. Blood pressure medication. She was on 6 different ones. Now she's not on any, and her blood pressure is better than ever. This is Kimberly. Welcome aboard.
Hi,
Hi,
Thanks for
Kimberly.
joining us.
thank you for having me today.
I wanted to throw out the blood pressure stuff because we know that that's one aspect of you adding peptides into your regimen. So walk us back to when you felt crappy and you just knew that there was something different that you could do. What was that moment and how did you feel?
So, when I first noticed how I was feeling, I was actually at the gym and I was walking the track, listening to an audiobook, and I was like, man, something just doesn't feel right at this moment. And so I went over to their little blood pressure arm machine thing, that you see at grocery stores and various places, and it was crazy high. And I sat there for a minute going, okay, I'm at the gym, I'm working out. Is that why? No, I'm walking, right? Like I wasn't doing anything too wild. So I called my cousin who's a nurse and I told her what the reading was at that point. And she's like, you need to go to the urgent care right now. I'm like, okay, okay. So I rush over to the urgent care and they immediately start doing all kinds of stuff, checking everything, running lab work, got me on some medication that night. And I spent the next year just adding medication, just
Mhm.
continually adding. Nobody could get it
Trying to
under
stabilize.
control.
Yeah.
Yep. And it would come down a little bit. At its worst, I was at 190 over 122. And I'm only 45. So that's pretty
That's pretty
high
high.
for, yeah.
That's pretty high
Uh,
for anybody.
and it's pretty
Whew.
concerning. Yeah. Like,
No wonder
and the
why you didn't feel
audiobook,
good.
yeah, and my audiobook wasn't that intense. It was like something's wrong here. So, but over a year, we didn't make a lot of progress. I think the lowest it came down was like 140 over 100. With 6 medications, that's just not enough. And
Were
adding in
you,
exercise and, changes to how I was eating and trying to be mindful of my stress, like nothing was happening. And then I talked to my brother one day, last fall. We were taking care of my father. He'd had a huge medical emergency. He had an aortic dissection, and I was
oh,
in the CICU. That's a whole other story of grief that compounds onto my
oh,
journey.
of course. Yeah.
Um, but I was talking to my brother, and he goes, "Well, have you ever heard of BPC 157?" And I'm like, what are you talking about? So he's like, oh, I've been doing it for ages. I'm like, what is this and where do you get it? So he starts telling me about it. He's getting it, on some black market dealer out of God only knows where. And I was like,
Don't
well,
do
I
that.
mean, right? I
Yeah.
know. I was
For
like,
those
well,
listening, don't do that.
I was like, that sounds a little sketchy, but I mean, okay, let's look into this a little bit more. Um, so after hearing his story and then looking into it myself, going online and asking questions and, just trying to learn about it, I decided to start with BPC 157. And within a couple of months, I started feeling better. And that was only September of 25. And here we are, what is this, February? I think I messaged Kylie last week and I was like, you're never going to believe this. My blood pressure was down to 122 over 84. Um, so
And no
just a
medication.
few, no medications. I was off all of them by December.
That's
So
incredible. Well, for anybody listening, so BPC 157 stands for Body Protection Compound. And one of the main things that it does is not only does it repair the gut lining, the smooth tissue in the gut lining, but it targets soft tissue repair. It targets that smooth tissue in our body. So when we're talking about cardiovascular stuff, smooth tissue, this is what we're talking about. So no wonder why you were having such a phenomenal response with that one compound, which does so much. It does so much.
it's one of my favorite. I
Wow.
I
So
still use it.
do you do you,
I
cy- do you cycle it, or what was
so
your
I
journey with it?
I did cycle. My brother had mentioned that that was something that needed to happen, and he's like, "Yeah,
When
you
you
should." I did
when you
12
say
weeks
cycle,
on.
are you doing injections? Are you doing the injection
Yeah,
form?
yeah, I
Okay.
do injection form. I did 12 weeks on, and at the time, what his regiment was, and so I just did the same thing, was once a week, 100 units, and So like every Sunday, I'm like, it's shot day. I'm going to feel great for the next week. This is great. I've changed that a little bit now when I changed companies of who I get my product from. But anyway, I was doing
Which is a
once a
much
week.
more legit source now.
Yes, a much better. And I actually really like the 5 days on, 2 days off that we do with it
Yeah.
now, that regiment.
Yeah.
So are you capsules now then?
Nope, I'm still injectable.
Okay, so I'm doing the capsules and it's the same thing.
Oh
Five
yeah,
days on,
okay.
2 days off. Hmm.
Yeah. Yeah, I'm really enjoying that. Um, you know what, Jessica? I forgot what you asked me. My brain just cycled out of
That's
it. I
okay.
got so
I was
excited
just
talking
asking
about
if
it.
you cycled. So you did 12 weeks on, and then did you take
And
4 weeks
there it
off?
was. Yeah, I was planning to take 4 weeks off, and I took 2 weeks off because I
Okay.
also have Ehlers-Danlos type 3, which is a hypermobility connective tissue disorder. And
Okay.
that first week off was the most horrifically painful thing I have ever experienced. I felt
Oh.
like a spring had been, when you wind a spring too tight and then you let it go, it goes boing.
Yeah.
That's what my joints felt like, and it was like my skin was holding me together. And so immediately after a
Oh.
week, I was like, what is different? What is happening? So, I'm like, oh, I bet it's my BPC. So I started looking because I really wanted to take the break. So I started looking into it and I realized that glutathione might be a good option to kind of help bridge that. So
Okay.
I added in glutathione, um, and it did amazing. The way it felt in my body is BPC reminds me of the friend who walks into the room, at a party, and they're like, I'm here. And everybody is so excited to see them. And, everybody knows they're there, where glutathione is the friend who kind of comes in the room and quietly circulates the edges. And everyone gets a hug and they feel all warm and fuzzy. It's a much more subdued reaction that I feel, but I know it's happening. And so I started that 2 weeks into my cycle off. And that helped tremendously. It quieted down all of that joint springing apart feeling. So I was able to cycle off for 3 weeks, but then I got a little bit antsy and I was like, I want
You
it
were ready.
back.
Yeah.
Yes.
I think, and I just want to tell people why I asked that question, because when we're doing some of these longevity peptides, it's important for certain ones to be cycled because our body isn't naturally shouldn't be turned on all the time. We shouldn't be working at this optimal, always on, that's not natural in our body. So cycling for 12 weeks, maybe taking a month off and then 12 weeks on again is important for that reason. It's also important, part of the reason why the telemedicine platform that we use, when those prescribers are talking about it, they're talking about 5 days on and 2 days off. Again, because we can't have us always at that top level of everything's on and everything's working and all of that. So everybody's journey is individual, what they need. In your particular case, the BPC is crucial for this diagnosis that you have. When you went back on, did that all kind of come back together too? Did you instantly know, oh, thank goodness it's in my
Yeah.
body? And yeah,
Yeah.
okay.
It was like within a day. And it was a much lower dose because I went from the 100 units once a week to I think it's 20 units daily. That's a big
That's
switch
that's a
on the
huge
daily.
huge switch. Now you're working with a provider, obviously with the telemedicine, and the provider knows your diagnosis.
Yep.
Is there a change normally with this with it, like I said, it's a cycle. It's 12 weeks and then there's a break and then there's 12 weeks. Are they looking at you any differently as an individual need, or they still suggest you're going to do that cycle of being off, or no, because in your this is your case.
Mhm.
It is something that you're like, no, we need this like regularly for you. Or
We actually haven't talked about it in depth yet.
okay.
I did share my feedback with them, so I imagine the next renewal that we'll talk about,
Yeah. I
are
was
we going to
just
take a
curious if
break
they
or,
changed
yeah,
that,
yeah.
with this
I get
situation.
the impression it'll be fairly individualized. Um, I think that's part of the renewal process is just asking questions and making sure how things are going. But yeah, the BPC was like, I've got to continue this at least for a while, continue getting that inflammation down, healing all of those soft tissues. Because
Okay.
on top of the Ehlers-Danlos, I also deal with POTS and MCAS. So there's a lot of like angry inflammation happening.
Sure. And that knocked all that down. So,
Yeah.
uh, yeah, that's a whole
Kimberly,
nother
I want to ask you,
conversation.
has anything, because these aren't diagnoses that are recent. Like,
No, I've had
you've
these for a
had
long time.
these for a long time. Has anything else benefited you in the same way that your BPC 157 has?
No, I've had chronic pain. So it started in 2007 when I had both of my hips rebuilt, and that's when they discovered the Ehlers-Danlos.
Okay.
And then it's sort of been a slow rollout from there. It's like, oh, well, people with Ehlers-Danlos tend to have these other things, so they start asking questions, and you're like, oh, yeah, I do experience, POTS symptoms, way before POTS was cool. And I'm like, yeah, is that
Exactly.
not normal? Is that not normal? We don't all do that. And
Mhm.
it's just kind of been this slower rollout. I have noticed the MCAS has been a lot more flared post-COVID era, and then now in this grief era that I'm living in, that has definitely increased my flare-ups there,
Okay.
which has been an interesting thing to experience and then try to figure out like what's going to help with that. But as far as like traditional methods, the Ehlers-Danlos, I was told, well, you just kind of deal with it and treat symptoms as they pop up, and
Have you
there's
added
not.
anything else into your stack besides the BPC and the glutathione?
Yeah, so I do microdose the GLP-1 GIP.
Okay.
And I also never get this name right. See if I can remember it. Thymosin alpha 1.
Yes.
I
Thymosin
got
alpha
it this
1.
time.
Yeah.
Yes.
TA1.
Yep.
Oh, we love that one. Okay. Is that new? Did you just, I know that
I
that was
started that, I think, in January.
in
Uh,
January. Okay. And since you added that one on, because we know this is huge for people that don't have a good immune system, people that either get sick all the time or people that get sick that don't heal well, or autoimmune conditions because the immune system is overactive, which can also be the case in some of these things that you have going on. So this is we're so excited to talk. We're going to talk a lot about TA1 this coming month because we're so excited about that. But to hear you have this experience with all these big diagnoses that so unfortunately are common,
mhm,
um, did that change your, so the BPC helped, right, with your
mhm.
POTS and your MCAS. Did the TA1 influence that even further? Have you found that that's had impact on it, or that one hasn't impacted those two particular things?
I haven't noticed a whole lot yet, other than I feel like I haven't documented it, but I feel like my MCAS flares are quieter.
Yeah.
They're not gone, but it seems like they're less intense.
Yeah, I
So,
mean, that's what we would kind of expect to be the journey with TA1 is that
Yeah.
kind of quiets some of that response down.
Right.
But
yeah.
And with MCAS, I know we all know what we're talking about. Can you explain a little bit, Kimberly? Because I don't think a lot of people know what MCAS is and even POTS. The three of us
Yeah,
do,
so
but explain
we
a little
know,
bit.
yeah. So the MCAS is mast cell activation syndrome. I believe it's syndrome. And it's these I don't understand the sciencey part of it as well, but the way I understand it, it's a cell that or cells probably that overreact to things that I'm exposed to,
yeah, it's
and
a
create sort of a
essentially
histamine.
histamine. You're right,
Yeah,
histamine response. That's
yeah,
too much.
yeah,
Right.
yeah. It feels like my body is telling me I'm allergic to everything around me right now.
Okay.
Um,
That's a great
so
way to explain it.
I do take an H1 and an H2 blocker,
Okay.
almost daily. Can't say that I notice a lot with them. If a flare comes on and it's really, really high, then if I take it, it does get a little bit quieter. But as far as like maintaining it, doesn't really help a whole lot, I don't think.
Right.
Um, and it's so person to person because we react to everything very differently.
It is. And I would imagine with the BPC and working on healing the gut, which can be very much tied to both of these diagnoses really is also
Hmm.
having an impact on all of it. Now you add the TA1 supporting that immune system, that's huge. And then POTS, because people want to
So
know that
yeah,
it's
POTS
more
is
common.
post-orthostatic tachycardia syndrome.
Nice.
Yeah, see, I'm like, I think I got that one. I have it fairly well managed through electrolytes. So for me, and
Wow.
everybody's journey is a little bit different, but for me, when it's electrolyte imbalances are
It,
really, really key. I cannot get enough sodium.
yeah,
I'm that crazy person that adds salt to absolutely everything, and
yeah,
your eyes bug out when you watch me.
yeah,
I'm drinking electrolyte fluids all the time. I'm taking, sodium tablets all day long, and I will still be at the very end of normal. Like
right.
at the lab I go to, 130 is is the very, very lowest that they will call normal. And I'm sitting there at like 129, 130 all the time.
Despite
What's
all
So,
of what you're
interesting is you
taking.
have this, but you also have this blood pressure. You
mhm.
had this
Yeah,
high
good.
blood pressure.
Make that make
Interesting.
sense, right?
So that is really wild to me that you have both of these issues that came up for you. So for people that are listening, which she gave the name of what POTS is, but basically it is a blood pressure imbalance.
Hmm.
I know I have really good friends that had suffered terribly from it, and they have to, when it's really bad, they have to go to the ER and get
Yeah.
saline.
Yeah. That is the
IV.
best. If I could get saline at
Yeah.
home, I would just be like, here, hook me up.
Yeah, yeah. So
Um,
that salt component, that electrolyte component, which I talk about in my work all the time, is so important. But somebody with POTS, the more salt, the better. And by the
yeah.
way, anybody that's listening that has cardiovascular issues and you're told typically to not have salt,
Avoid sodium.
no, no, that is not the truth.
Yeah. It would
So
never work for me.
okay, so you have quite a beautiful stack.
Yeah. This is what's working well right now. I'm constantly looking for others that may help. Um, just
But at the
I'm
same time,
curious.
you're giving yourself long enough to react to each one,
Yes,
which is
because
what
with
my thing
my
is start one,
yeah,
see how your body does, then add the next, see how your body does, then add the next to see like that's a
yeah,
great
I try to give
pattern
6 to 8 weeks
for people.
at least
Mhm.
to
Uh-huh.
see what I feel and how it interacts with the other things. And I try not to have because like the BPC is daily, the thymosin is daily, and then like a week off. But I try to not do them all at one time either because my body is very sensitive. So any vaccines that I get, I can't have them together. So like Tdap, I have to have that separated out. I can't do it all at once. So I'm also going to try not to put too many things at one time into my system in a given day. I may do, 8 a.m. and then noon and 4 if I've got 3 to do, but I try not to do it all at the same time.
And
Um,
different injection sites, I'm assuming
yeah,
too.
yep.
Yeah.
And I find that the injection site really is dependent on which one I'm using too. Like my GLP-1 GIP, I cannot do it in my abdomen. It has to be in my leg.
Why
Um,
is that? I mean, I know that people,
yeah, I get really, really sick, even
okay,
microdosing it. I
okay.
get the GLP-1 flu really badly. So it's just the way that my body processes it, depending
Yeah.
on where I
Yeah, I
inject.
mean, you
So
have MCAS, it's MCAS. I've always said MCAS. So like you're gonna react, which is smart of you to know. But as we're listening to your story and hearing your story, not only are the peptides so powerful and so cool for you, but I love the fact that you did not just accept your diagnosis and just be like, well, this is how my life's gonna be.
nope.
So this is the label next to my name. That part is like the first mental barrier that people have to overcome if anything is going to work for them. Because I know POTS has flared around recently in the last couple of years as the cool thing now, and where fibromyalgia had its turn a couple of years ago as well. And it's like, if that's your identity,
Yeah.
nothing's going to work for you. So you cannot suck it on as an identity. You just need to say, okay, well, my symptoms fit underneath this umbrella. What can we do about it? And then move forward on how can I feel my best, no matter
Yep.
if I'm 45 or 55 or 95. I don't care. I want to feel my best. What do I need to do that? And peptides are a
Mhm.
great way to do that. So
Yes. Yes.
go
And
ahead,
they
Kimberly.
also have really supported a larger goal of mine in living with these diagnoses. I um I was blessed to have my son almost 12 years ago. And prior to him, I had had 9 losses. And so when I found out that I was going to have my son, um, not only was I elated and terrified all at once, right? But I was also determined that I am going to get to live his life with him and do all of those toddler things and all of those little kid things and all of those middle kid things and not be sidelined because of my joints are hurting or I'm having a flary day with my pots or like I'm not going to do it. This is my opportunity that I didn't think I was going to get to have and I will not miss out on any of it. Um,
That's
so
beautiful. Life is so precious, and he's one of your many reasons to do these things and not be stuck in these things. But I think there's an awful lot of people that are going to hear what you just said, and they can completely relate to it. Kylie knows I say all the time, peptides are allowing us to live longer, better.
Yeah.
And you totally gave one of the most important reasons. So somebody that is walking their journey and feeling like there's no hope, this is something that these longevity peptides or other healing peptides, or even the GLPs, because they go farther beyond weight loss, is something to consider. Because whether you are in an age like you are, where you are a mom that wants to be a parent and be present and active in their child's life, or you want to be a grandparent that is an active grandparent, at the end of the day, we all want to live longer, better, and be the best version of ourselves and be in the moment and enjoy every aspect of life. I really appreciate you sharing that. That's really beautiful.
Yeah. Yeah. I don't want to miss anything that he does and asks me to be part of. It's a beautiful journey. So
Some days
Kimberly,
tougher than others.
yes, we're coming into 12. There are days that I'm like, what did I sign up for?
Right. Listen, mine are all older. I get it. So even those days as adults, you still think, whoa.
mine are
Mhm.
younger, and I'm still like, can I just sleep in my bed all night long, please? I don't want
That
to
day
get out
will
of my
come.
bed or have someone else in it.
And it will
Uh-huh.
go and you'll miss it.
Hmm.
Yeah.
That's a great
So,
story.
Kimberly, as we finish up your story here, which is incredible, like congratulations on what you've accomplished and are still accomplishing. I want to touch note on when you say that you are working with a practitioner, is this through the telemedicine company?
Um, yes and no. I have a functional medicine doctor that I work with as well,
Okay.
who follows me a lot closer in the entirety of my health journey. And then my telehealth medicine providers, we touch base. But that is part of working with them is you have to have a provider outside of the company as well.
Yeah, that's part
Um,
of the medical intake form. They want
yep.
to know that does your provider know that you are
Yeah.
walking this walk? Yeah.
Yeah. So I personally use my functional medicine provider more because I can sit down with her for 30 to 60 minutes and whenever I want to, and we talk through things like just this week. I called her because I was noticing I was having more flares. And so I was like, okay, what's different? Because like I said, my grief and losing my dad has been very impactful in how my body is responding to everything. So it was the questions were like, is this a grief response? Is this a different part of my grief? Is there a change that we need to make to any of my dosing? What do we think? Where
Mhm.
in the telehealth provider arena, um, we talk more one-on-one about one peptide and how that's making me feel versus the entire
The entire
picture.
story. Mhm.
Yeah. Yeah. So I
That's
lean
a
into both of
super
them.
helpful perspective. And maybe it's functional medicine. Like I've got a friend who's doing her microdosing and she's working with her primary care physician, getting labs done, all those things, monitoring it. And then she goes through the telemedicine company as far as specific questions and
Hmm.
dosage information about the peptides. So it is like really a team effort in addition to like you are the leader of your team. It is
Hmm.
you, and it's the same with so many people. This is why a lot of us get into the practitioner space, is because we've walked that journey and now we had to go do it for ourselves so we can share it with other people. So adding
Yeah.
in that telemedicine company that we all love and know and work with, that they're part of the team.
And you know what, Kylie? I just remembered there was one other thing that I had made note that we were going to talk about with my peptide journey. It was the GLP-1 GIP
Mhm.
because I actually started on a compounded outside of our telehealth company um, 2 years ago, I think now, and
So that was
I got
before the BPC.
way before the BPC,
Okay, let's hear
and
it.
I started on that, and it was going great. Like, oh my gosh, excellent! My lab work all improved. So I started this journey in functional medicine because my father had his first heart attack at 46 and he had a widowmaker and he survived.
Wow.
And I genetically match him like step for step. So as I've gotten into my 40s, my lab work has trended almost identical to his. And as I'm sneaking into 46, this is not something I want to experience. So I've been working on it for about 5 years with my providers. And one of them finally suggested, have you thought about, you know, a GLP-1 at that point? So we started on it. And as we all know, protein is a very important component. And
Uh-huh.
so I started on a protein powder to try to get more in my day, and I ended up hospitalized. And everybody, it was for pancreatitis, so everybody immediately assumed it was GLP-1. And this happened to me twice within a couple of months. So then they were like, nope, we're done. No more GLP-1 for you. Yes, your labs look great. Everything was improving. Like my cardiac function looked so good. It was great. I went through some serious mourning when I had to go off of it because they told me I was allergic to it. I was just like, you've got to be kidding me. How am I going to make this happen? How am I going to continue to keep this healthy trend? And I'm going to use the word fought, but it wasn't like fighting, right? Not mad fought, but I had to really advocate for myself for the next year and found a different provider in the same practice who was willing to listen after I had done some research. It wasn't the GLP-1. The protein that I was using, they are actually, their company is under a massive pile of lawsuits for the ingredients in their protein powder causing people to
Stop
be
it.
hospitalized. Yes. And so when I showed her this data, she was like, "Well, okay, I'm willing to work with you on this to try another GLP-1 GIP because I don't want you doing it by yourself. And I feel like you're going to try it
Yeah, you're gonna
anyway."
try it.
Yep.
Yeah.
And I was like, "Yeah, you're right, I am. And I would rather you know about it and me not have to go rogue. I'd
Yeah.
rather work with you." And turns out that wasn't the problem. I've been back on the GLP-1 GIP for 4.5 months and I haven't been hospitalized once. So it was definitely this protein powder. So I guess my caution to that is be careful and mindful and do your research on what products you use on any of them. Proteins, peptides, supplements, research it. Because I sure didn't on that first one. I took them at face value and it cost me.
I I watch people regularly that are trying to pour protein into their body, sneak it in, right? Because we have to hit markers in order to preserve muscle in our body. It's really important. And when your appetite might be suppressed a little bit, it's hard to do that. So I get why people are doing it. I use a protein powder. However, I use a protein powder that has like three ingredients, right? Like it's
Yeah.
clean, it's whatever. You get a protein powder, read that package on the back end or anything else, even your supplements, turn it around and find out what is in it because there's a large possibility it is full with a lot of fillers and a lot of things that you do not want in your body. So it's not that protein powder is bad. However, there are a lot of bad
Yep.
protein powders out there. I have not heard of that. That is a wild experience, but I'm really glad that you stayed strong and knew that this was something that was helping you. That is an important
Well,
piece to your
and the
story
only
too.
way that I figured it out was we got dad home from the hospital in early September and the doctors had been, he needs more protein, he needs more vitamins, blah, blah, blah. And I'm like, oh, I have this great protein powder. So I bought it and I was giving it to my dad and to myself, and we were both sick within like a day. I was like, oh, what is wrong with both of us? And I was starting to feel the same way I
Connected
did
the
when
dots.
I Yep. And I was like, wait a second. So then I started researching, what was going on. Obviously, we took us both off of it, started researching that company more. And that's how I figured out this is probably what it is. Um, and then just being very grateful that I have a medical team that was willing to be like, okay, I hear you. And yeah, thanks for sharing this with me. And let's move together cautiously.
Yeah, I think
Yeah.
that's a really big part of your story too, because there's an awful lot of peptide illiterate practitioners that are out there that they only see how GLPs specifically were being used really, in my opinion, irresponsibly. Not the educational component wasn't there, supporting people in their foundations, which has to be part of the journey. And so people were losing rapid weight. They were looking terrible. They weren't getting the nutrients they needed. So the automatic is peptides are bad. Or the opposite is, yeah, go on a peptide, but we're going to rev you up really fast and we're going to get this weight off from you, which is also not good. But if you're getting that bad information and you know that it's something that may align with you, then you fight with, bring information to your practitioner. And if they're still not listening, whether it's about GLPs or anything else, run, Go find
Mhm.
that person that's willing to hear you and be your own advocate. And I hope that in this platform with this podcast that Kylie and I are doing, we are able to provide people with stories like yours and bring the information forward so that people can feel strong and confident in their decision to bring that to the forefront.
Mhm.
And along with that, I do know that our telemedicine company has a protein powder that you can
Mhm.
also order from them. And along with that concept, ingredients matter. Where these are sourced matters. I had a message from a practitioner who I know pretty well, and she says, Kylie, I'm really hesitant about peptides because every time I muscle test them in my office, they don't muscle test strong. And she said, now, granted, I've never had any of them come from your telemedicine company, so I don't know how they work. But anytime I get them, patients bring them in, I muscle test them, they never test positive. And there's a problem not just in the protein powders, but there's a problem industry wide of where these are being sourced, and the not just the dosage, but the where they're getting their raw materials from. And that goes along the lines of everything in the wellness industry. Doesn't matter if it's protein, doesn't matter if it's peptide supplements, like oils, all the things you get what you pay for. And obviously, we want to feed our bodies the best of the best. That's why we're doing it. So we all three of us recommend the best of the best. And we have more incredible information coming out about where our materials are coming from and why you need to come through with us. But we're on board with this company for a reason, multiple reasons, but one of those is the source of where they're getting their materials from and the quality of the peptides. And then that assistant support, whether you're wanting to jump on a consultation with the provided practitioner to get started. Like Kimberly started with her GLP, GIP combo, and then she did BPC 157, and then she's added on from there. You want to start with the right thing that's for you and then add on from there, but just start with one. That's all it is. I started with BPC 157 and I've added methylene blue for the cellular healing component and the brain power. My brain needs help after what I've been through. Whose brain doesn't? And then the BPC, like I didn't no idea that it had the cardiovascular component. And I'm
Mhm.
already thinking like, wait, I could have this person and this person. And luckily one person that's most important to me is already on it. So I'm curious to see what's happening with his cardiovascular stuff. But they're so multifaceted that they're fascinating and you know, give them a shot. No pun intended. All right, guys. So, Kimberly, can they go find more about your story anywhere?
No, actually, I've never been asked, so this is it. You
This
have
is
the
it.
exclusive. Yeah.
Exclusive interview with Kimberly, all about her peptide journey and not just overcoming her health problems with peptides, but experiencing the diagnoses, the grief, and then managing it and improving, not taking those diagnoses on as an identity. I love it. Jess, where can they find you?
Well, as of right now, as we just have mentioned previously, right now you can find me on Instagram, JessB_LMT_NC. I promise, guys, I am changing that handle. It is a mouthful to say, but find me there. You can also, if you want to work with your peptide journey, you can find me on my website, which is b2bwithjess.com/peptides.
You can find me at drkylieburton.com, whether that's starting your peptide journey or whether that's somebody who maybe you're a health professional and you want to incorporate these top of the line peptides into your practice or to your online audience as an affiliate. You can also get started at drkylieburton.com. If you have been sent here by somebody else, please go back and get their resources for peptides. But we are so glad to have you guys on board, and we cannot wait to share the next story with you. This is Pep Talk, Peptides Unpacked.